Welcome, my friends, brothers and colleagues from the medical career. Welcome to this your channel, Clinical Consultant. Previously we were talking about liver abscess, and its great importance in the clinic. This time I come to talk to you about breast abscess, a something short but important topic. It is important to tell you that if you want to further expand your knowledge, consult your medical texts. Without more to say, we can continue. Definition. Breast abscess is an acute inflammation that determines the formation of a collection of pus. Typically, a very painful erythematous mass will be found in the affected breast, which sometimes drains through the skin overlying the infection or through one of the nipple ducts. Types of breast abscess. In the breast abscess we have 1. Subareolar abscess, and 2. Lactation or referral abscess. As we see in the image, in the arrows that point, we can see sparular infiltration that even invades the galactophagic ducts. Epidemiology and demography. 10,130% of all breast abscess are related to breastfeeding. Acute mastitis occurs in 2.5% of nursing mothers, and 1 in 15 will develop an abscess. Signs and symptoms are painful induration and erythema affecting part of the breast, resulting in a fluctuating abscess. As you look at the image on your right, we can see a breast abscess. It can be seen erythematous and somewhat greenish. This is how you can see. Etiology. Lactation abscess. Stasis of milk and bacterial infection that determines mastitis and then an abscess, standing out among all the microorganisms, the Staphylococcus aureus. Sparular abscess. Involvement of the primary ducts, with changes due to obstruction in the nipple ducts, causing a bacterial infection. Mixed-type cultured organisms including anaerobes, Staphylococcus, Streptococcus, and others. Diagnosis. Differential diagnosis. Breast carcinoma. Carcinoma evolving with erythema, edema, ulceration or several of them. Tuberculous abscess, rare. Hidradenitis of the skin of the breast. Sebaceous cyst infection. Assessment. The clinical examination is sufficient. If an abscess is suspected, it should be referred to surgery by incision, drainage and biopsy. If an abscess or evolved carcinoma is possible, a specialist should be referred for a more internal evaluation. Lab tests make CNS of the abscess content. If a mammogram or ultrasound cannot be performed due to discomfort, they should be performed after resolution of the abscess. Treatment. Non-pharmacological treatment. Established abscess, incision and drainage, and if possible under general anesthesia. Biopsy of the abscess cavity to rule out carcinoma. Acute treatment. Antibiotics. The pathogens are usually Staphylococcus and lactational abscess. Initial antibiotic treatment with nafcillin or oxacillin 2 grams every 4 hours intravenously, or cefazolin 1 gram every 8 hours intravenously is recommended. If acute mastitis is early, resolution without drainage is possible. In sparular abscess, drainage and broad-spectrum antibiotics to control the acute phase. Chronic treatment. Surgical treatment of recurrences or fistulas. Forecast and referral. Forecast. Lactation abscess. It is possible to continue breastfeeding without affecting the infant. Sparular abscess. The ability to recur or be complicated by the formation of a fistula is notable. the patient must be informed and referred for further care. Derivation. If abscess drainage is needed for surgical consultation, if there's a spirit or abscess. Thank you very much for watching that video. The next video will be pelvic abscess. If you like this video, give it a like and subscribe. There will be much more content like this. Greetings.